Goiter simply means swelling of a structure in front of our neck here called thyroid gland. So this particular body structure is very tiny. You can't even feel it when you press your hand unless it is swollen. This thyroid gland produces what we call thyroid hormone. There are several causes of this gland to be swollen. It could be an underactive thyroid gland, meaning that this gland is producing less hormone. It could be an overactive thyroid gland, meaning it produces excess hormone. It could be that the iodine level in your body is low. This is another reason why it can be swollen. It can be due to hormonal changes during pregnancy, menopause, or during puberty. Okay? It can sometimes be an ordinary swelling with no changes in the hormone. And sometimes it could be due to cancer. Yes, these particular glands can equally be cancerous, can have a problem with cancer. Okay, and that is rare. So there are several other causes. Some of them could be due to your immune problem. We call that Graves' disease, but this is not too important to you. Okay, what is important is that treatment depends on the cause, as mentioned, and the risk factors, meaning what could predispose one to develop this goiter. Before going into that, women are more at risk. Again, women are more at risk. The risk factors are as follows. Age, it is more over the age of 40. Gender, it is more in women, as I previously said. Family history. Diet. People who eat foods that are less in iodine are more predisposed to have goiter. Okay, because less iodine in the body is one of the causes of goiter. Some treatments like medications or some form of radiations exposure can equally lead to goiter. Additionally, pregnancy, menopause, obesity are equally risk factors. So, you know that most of these things revolves around women. Okay, it will be very rare for you to go out there and see a man with swollen neck due to goiter. It is usually seen in women. So what do we do? Like, what should you do as a woman to prevent yourself from having this goiter? One of the easiest things to do is to watch your diet. Try as much as possible to eat things that have enough iodine so that you won't have iodine deficiency. Most of the foods around us that have iodine are seaweeds. Like, most of these things are not eaten in some parts of Africa or that I'm not so sure. Some fishes like tuna, cod, shrimps. Our dairy products like milk, yogurts, and all that. Your egg. Okay, and some salts comes as iodized, like some salts come with iodine in them. Okay, I remember I used to use some of them in the past. So you have to try as much as possible to make sure that your meal gives you iodine. Okay, because during pregnancy, your iodine level could go down, and if you develop goiter or any problem with this gland here, the pregnancy will come with lots of complications. So what is behind the goiter, that is what caused the goiter, determines the treatment. If it is due to underactive or overactive goiter, medications are given. If it's causing complications like pressing here, like when it grows bigger, it will cause you problem with breathing, with eating, or causing you cough, surgery is usually indicated. Okay, so the doctor will do some series of tests, including ultrasound here, to determine what is there, the size, what is actually behind it, like what's causing it, and he will now propose a treatment based on his findings. I hope you've learned something. Thank you very much. Bye.